Okay, we are live, which is super cool. I've not done a live on my Facebook group for a long time, and I'm really excited to start bringing some interesting conversations back. And hi, everybody. If you don't know who I am, or you have not seen me on camera for a while, my name is Terea Rodriguez, and I am a FDN-P, or a functional diagnostic nutrition practitioner, which is a mouthful, but FDN for short. And I really wanted to bring my friend Linda Downey here to have a conversation about really what is the difference between functional and conventional medicine. We see these terms a lot, and sometimes it's not very clear what those differences are and also our experiences. But, you know, Linda is a colleague of mine in the FDN space. And Linda, why don't you just introduce yourself and kind of give us a little bit of background and how you ended up being an FDN, and then we can dive into the topic material. And of course, if anybody has questions, we are monitoring the chat through the StreamYard thing, but not on Facebook. So if you do want to register for us to see who you are and what the questions are, go ahead and register with that link that is on this post. Or, right, they'll see it on the post. I think they will. Anyway, yeah. So, Linda, take it away.
Yeah, thanks, Terea, and thanks for letting me chat with you today with your tribe. It's really an honor to hang with you guys. And so, yeah, I'm an FDN also, and Terea and I met through a business event, and we're so happy to discover that we had not only similar or the same credentials, but similar, I think, somewhat similar pathways to how we got here. So I'll just share a little bit about mine. I became an FDN after I became an integrative health coach, after I was really sick for a really long time. That's the short version. But I always had a passion and interest for health and wellness. In my 20s, I got a master's in exercise physiology, and that's what I did. I was a wellness fitness professional, but I was the sickest wellness professional you would probably find, and the fattest personal trainer you would find, because I couldn't lose weight and I didn't have energy, and I really struggled with multiple autoimmune conditions throughout the last 25 years or so. And so at one point, this brings us to the topic of conventional versus functional. And let me just say, I love conventional doctors. I love what they bring to the table. I love my doctor. I mean, my daughter had extensive medical issues, and I loved her doctors. So this is not, because sometimes I do hear that, a disparaging of one or the other. I think that they both serve a great purpose. This is my opinion anyway, that they both serve a great purpose, and they both bring something to the table. So, you know, that's the background behind what I'm going to say. But I had gone to many, many doctors in the 25 years that I was sick, starting with ulcerative colitis in my 20s. And that doctor, so I'm 55 now, so that was 35 years ago, right? That doctor, he said to me, and he was not a young man, he was an older man. He said to me, this has a lot to do with stress. You're not going to find that in any of the textbooks, but I'm telling you. I was like 22 years old, 21 years old.
Wow.
Back then, which I thought was pretty remarkable, because anyway, but I was on medications, right? And then Graves' disease. I got Lyme disease when I was around 26. Then the Graves' disease, then adrenals crashed. You know, at the time it was adrenal fatigue. I think that is changing a little bit in how we look at adrenals, but, and then Hashimoto's. And each time I was on prescription medications and would go to the endocrinologist or the GI doctor or whatever. And I finally said to my endo, like, why does this keep happening? And why do I have Hashimoto's when I used to have Graves' disease? Like, why is that? And she said, I don't know, that's just kind of what happens. That was, you know, that was her answer. That's what happens. Your thyroid is not working well. And it was after that, and that was in my late 30s, early 40s, I guess, when I said, I'm just not going to keep doing this. I'm just not happy with that's what happens. Because let me tell you, as a fitness person, I ate what I thought was really well, right? I used to do triathlons, which meant I loaded, right? I did my pasta and I did my bagels in the morning before a long run. And so but in the 80s, that's what we were told was healthy, right? So I thought I was doing things right, and I was just getting sicker, and nobody was giving me answers. So that's when I went back to school as an integrative health coach. And then I knew I wanted to work with people who had autoimmune conditions, which I think is what you do too, right? Or significant. Yeah, I didn't want to work with just somebody who, wanted a flat belly. I'd been doing that as a personal trainer, but I really wanted to make a difference because I saw how I wasn't getting my questions answered. So I knew I needed to go for further education. And that's when I became an FDN, so that I could really get the tools and the credentials to do some things that would make a difference for people. And that's how I got here. But that's also my take on functional versus conventional a little bit.
Conventional. Anyway. Yeah, it sounds very similar to my story. So, prior to becoming a health coach or a functional medicine practitioner at all, my profession was as a professional pilot. So I was in aviation and I was flying for a living. And, it's one of those things that when you start to deal with a medical issue, there's a lot of FAA oversight, as there should be. And when I was first diagnosed with Hashimoto's and taking thyroid medication, I had to declare that medication, which put me in this special issuance medical program. And so I had more oversight. So instead of every 12 months, I would actually see an FAA doctor every 6 months. And, he wanted me to work with an endocrinologist. The endocrinologist had to provide lab reports to prove that my thyroid was stable. And the issue was it wasn't. I mean, that was the reality. We would run a test and my TSH would be super high, like 15. And then the next time we would run it to show that it had been stable at all, and it was supposed to be between like 0 and 5, it would be way down by 0, which wasn't normal either. And so, when I told him, I kind of cornered him a little bit because I was under a timeline crunch. I had 30 days before my aviation medical. And if I couldn't prove with multiple lab tests that my TSH was between 1 and 5, I was going to get medically grounded, which is not a good situation to be in. And so I said, what are we going to do? Because I've got 30 days, like my exam's in October. And if I can't pass that exam, then I'm going to have to stop flying. And he just put back his hands and he was just like, look, I don't know what else to do because we've done, all the things that I know to do with prescriptions. We're just going to have to irradiate your thyroid and cut out the rest of the tissue. I was like, whoa, whoa. Okay. Because, you and I both know that thyroid issues and Hashimoto's and hypothyroidism affects millions of women in this country alone, not even to mention the numbers worldwide. And why was it so difficult for me to get it stable? There were so many other women that had it stable without surgery. Why was this such a difficult thing? And that's when I really started to question whether or not his knowledge as an endocrinologist was going to be enough to get me to a place where I could pass that medical without having to do a surgical procedure. And that's when I turned towards functional medicine. So, that was my experience with the conventional medicine world in terms of trying to deal with a chronic illness. It just didn't have a match.
Yeah.
So.
And I think it's important. I was thinking as you were just saying that, and piece of it, because sometimes I'll get clients who will say, I've worked with a functional medicine doctor and they put me on this prescription. So it's interesting because whether it's a doctor who came from conventional education and training and crossed over into functional or not, I'm not sure. But I think to my understanding, and I'd love to hear your input, is functional means looking at the body as a whole. Whereas typically in conventional medicine, they have their specialties, right? So they just focus on just the thyroid or just the gut or just migraine headaches or whatever they focus on. Whereas functional will look at how the whole body works and integrates, but it doesn't necessarily mean their treatment choices, right? So then there's that piece of, because you can have a functional medicine doctor who will say, okay, we're going to look at the whole thing, but they'll still choose to put you on a prescription or an antibiotic for a parasite, right? As opposed to, right? So that's also, I think, something to take into account when you're looking at who to work with.
Yeah. And I think, conventional medicine doctors have been trained in a particular methodology of thinking, which is the specialist thinking. It's if I'm going to get to a place where I really understand medicine, or I'm really interested in cardiology. Well, that's the science of how the heart functions. And so they become a specialist in the heart, but then they forget about the fact that the heart is connected, sitting right on top of the lungs. It's connected to the lymphatic tissue. It's connected to all these different things in the body. And so they forget about how those things are related. And same thing with endocrinologists. They're focusing in on the endocrine glands of this body, but they're not really focusing on anything else. And how are the hormones related? How is the brain related to that whole signaling pathway? And so, they become specialists. And I basically gave an analogy to a client not too long ago, where it's as if that they are in a forest and they're looking at a tree, and they're looking so close at the bark, and they're looking at the vascular system of the tree, and they're just looking at the bark piece of it and maybe the leaf of the tree. But what they're forgetting is that they're inside a forest where all of these trees are talking to each other through the root systems, and that they're actually much larger organism than just a single tree, right? So that is one issue where they're not treating the whole body as a whole. But then the other thing that's gone along with conventional medicine is this crossover with pharmaceutical companies, in that we've tried to apply the pill for an ill methodology. So if there is something wrong, let's apply a pill for that. Right. And I see that also with functional medicine practitioners. While they will look at the body as a whole, that application of that allopathic, let's give you a pill for a symptom, let's give you a supplement for a symptom, methodology starts to be put into place. And oftentimes it leaves clients still feeling like crap and still feeling really sick. And, so for me, even using the word functional medicine, in a sense, there's some downsides there too, because of these methodologies that have crossed over. And I think that's kind of what you were talking about.
Yeah, I think so, because sometimes, I'll be speaking with the client and they'll say, but I went to a functional medicine doctor and they put me on blah, blah, blah. I'm like, okay, well, so that's not necessarily, it doesn't define how they're going to choose to treat you. It may define how they choose to look at the picture. I love your tree and forest, and I'll be using that one. That's a good one. And I actually posted on Facebook on my personal page, I had planted my cucumber and a spaghetti squash in the same raised bed, and whatever happened underneath the dirt happened, but I got these big yellow cucumbers. So the skin was a little bit thicker. It tasted pretty much like a cucumber, but it was much bigger and fatter, and it was yellow, not green. Just because I plant, so like what was going on under the soil, right? So a little off.
Yeah.
When you were talking, I was like, that's my cucumber. That's what happened.
they were talking.
They were doing something under the soil. So anyway, I, just really understanding. And that's what I love. I learn on every client, because everything's a little bit, everybody's body is individual, yet we all have the same systems. They all need to work, like glutathione is important for everyone. It's not like not important for you or something, right? It's an important across the board, and the way that gets used is important. And yet what's happening with this person is different with that person. So there's just a really interesting, wonderful, I think, way to approach wellness.
Yeah. And I think, our medical system, the way that it's set up today, the standard conventional medical system, I mean, if you look at the history of it, at first they were really dealing with, severe diseases, the bubonic plague, and, the 1918 Spanish flu, right? The last pandemic that we were dealing with. They were dealing with these kinds of things. They were dealing with emergency medicine, and our emergency medical system is awesome. Like, if I ever get in a car accident, a cycling accident, I break my arm, like, I'm going there, right? Yeah. Because they're really good at crisis emergency management. Where it's fallen down, I think, is because, our world is just such a different place than it was even 30 years ago when you and I were growing up. We're dealing with way more chemical bombardment. We're dealing with way more stress on a day-to-day level. We're dealing with a lot of different things that lack of nutrients in the food system because we've commercialized the food system. Like all of these different things have kind of combined to create a perfect storm for a lot of people getting chronically ill. And with conventional medicine, the doctors, I don't blame them really, because A, they've been trained to be a specialist, and B, they're in a system where they're pretty much forced to spend 15 minutes with the patient and next, just turn over patients all day long. And they don't have time to really sit in the science and really understand what we're starting to see and the new learnings that we're starting to see. So almost all the technologies and things that we see in conventional medicine seem to be, in my opinion, 10 to 15 years behind. Has that been kind of your experience as well?
Yeah, I think that's fair to say. I mean, there's certainly cutting edge technology, but that's more for like surgeries, the way that they're going to do a surgery or something like that. But the other thing that I think, and I've read some articles about this, I think it's pretty on the mark, is that the pharmaceutical industry is very much immersed in the medical industry. So there's a lot of influence from the pharmaceutical industry on what's being taught in medical schools. And then you have
Absolutely.
the doctors who are, the pharmaceutical reps are going from office to office to office. And, if somebody comes in with this, you give them this. Oh, if they have a side effect, you give them that. So there's such a strong influence from the pharmaceutical industry on how our doctors practice medicine, and that's really the thinking is, what do they have? Okay, what am I going to prescribe? And that's how the insurance industry is. It's married to that whole thing, which is
absolutely
diagnosis code. And now what's the prescription? It's either a prescription or it's an intervention. Those are the two options, right? That's why functional medicine isn't really covered by insurance, because there's no codes for it. And I think it's because there's not a lot of money. I mean, I know that people feel like, well, I pay a lot of money to go to a functional doctor. Well, that's because insurance isn't helping you out, whereas they're helping you out with conventional. But long term, you're not going to pay because you're going to actually get fixed. It might take 6 months. It might take a year and a half. You might need some supplemental support if there was damage done ongoingly, but you're not going to be on this wheel of illness doctors forever, which is where the money's made.
Yeah, it's unfortunately, it's a very tight-knit system between insurance and pharmaceutical companies and the medical system. And it's really unfortunate because, like I said, while it works really great for emergency care, it doesn't work really great for the emergence of all of these chronic issues. And we're starting to see it in younger and younger and younger populations. Like we're starting to see Crohn's illness and things like that. And with people who are in their 20s, and it breaks my heart because, I know that a lot of this stuff can be prevented, but at the same time, our poor medical doctors, when they went through medical school, they don't get nutrition. They don't get this standard learnings and understandings of how the body works in these intricate ways from a biochemistry standpoint. They immediately learn these prescriptions, learn this diagnosable condition, learn the manual that's going to teach you how to diagnose these things. That's where they take them. So it's almost like they skip over a major chunk of what it takes to create a healthy human.
Yeah.
So, I think you and I went through the same training with FDN, and I love the analogy that we had in one of our very first courses, which is kind of imagining this gauge, right, from empty to full. Yeah. And the empty is us at birth, where we're perfectly formed human being with no outside influence at all except for the mother's womb, and happy, healthy baby, right? And you get all these influences throughout your environment and things you're exposed to, and your immune system building up, and the food that you're eating, and the stress that you're under, and all of those things. And, if you imagine 12 o'clock of that gauge being when you're diagnosed, that's when the conventional system takes over. So they take over at diagnoses, And then they take care of the management of that diagnosis through subscriptions. Prescriptions is kind of a subscription. Prescription, and then, you know, intervention procedures like surgeries and that kind of thing until eventually the person passes. And the whole like beginning part, right? That whole beginning part is all about maintaining optimal function and a healthy human being. And what we see with functional medicine and a lot of people who can take that holistic perspective is they take somebody from just before diagnosis or even after diagnosis, they can actually help them reverse those symptoms and restore health back over into this quadrant. Yeah. And that's really what we're talking about with functional medicine and how that can restore health for people who have been chronically ill, even if it's been decades.
Yeah. Yep. Yeah. Restoring the health. Yeah. That's really the difference, I think, right there is let's work on restoring health rather than, I don't know, band-aiding you through symptoms and illnesses, you know, just trying to manage your symptoms. So yeah, you know, go ahead.
Well, I was going to ask you, you know, your experience of being chronically ill for a number of decades, what would you say, was it an instant thing? Was it a single root cause? Like, did you ever find out that one single root cause, or have you really discovered that, you know what, it's multifaceted, it's complex, and
it's multifaceted and complex. And I think that's why we have to look at the body as a whole. You know, our thoughts, our emotions, the food that we eat, the water that we drink, it all goes into play. So, you know, with what I've learned with what causes chronic illness, I'm like the poster child. Probably everyone who has chronic illnesses is, but so emotionally wise, let's go even back to genetics. My mother had MS, right? So I have a genetic disposition. My mother died when I was 4 from MS. My father was an alcoholic. So I grew up in an alcoholic family with the loss of a mother. So you have that emotional component, right? I got mono Epstein-Barr virus in 9th grade, moved out of my house right after high school. So a lot of emotional stress from the whole growing up in an alcoholic family. Ulcerative colitis showed up at 21. So I don't think that that's coincidence. Then throughout my 20s, I'm sort of dealing with ulcerative colitis, irritable bowel, all of that's going on, but I'm trying to be a personal trainer and a fitness person. So I'm signing up for marathons and triathlons and pushing myself because I'm supposed to exercise more. That's what I was taught, right? So now I'm
me too.
Exercising, trying to eat pasta loading, which now I know the gluten was killing me. I used to eat a bowl of, like, I would make my pre-race stuff, doesn't even matter, and then my stomach would be like, I mean, literally. And I go to aerobics class with a loose shirt on with my belly huge, teaching aerobics. So, you know, and then just went through, my daughter was critically ill for 15 years. I cared for her from the night she was born. She was rushed for open heart surgery unknowingly to us ahead of time. And then, you know, Lyme disease. I forgot I got Lyme disease in my late 20s. So everything, Epstein-Barr, Lyme disease, chronic stress, over-exercise. And then I went from eating well to just eating out of the vending machine and pounding coffee at the hospital, right? That's what I did. Because by that point, I didn't care about myself. I just was at the hospital. So bag of chips, sandwich, who cares? Coffee. So you just throw everything. But at some point, I think the body can handle so much, and that depends on who you are and your genetics and how you're processing things. And then at some point, the body says, nope, done, you know?
Yeah. Yeah. And I think, you know, you're absolutely right. It's very important to take a look at a whole history for somebody, because I used to love the idea of finding a root cause, but what I've discovered is there's no single root. It's multiple roots. It's just like that tree again, right? It's multiple branches to the roots that are leading up to what's happening, and taking a look at all of these different stress factors and things that have happened in your childhood and those kinds of things lead up to it. And a lot of times it's at no fault to our own. You know, there's a lot to be said of for a period of time, we thought healthy whole grains, eating a lot of carbs was the way to go. So that's what we did.
Yep.
And, you know, I can totally remember carbing up before my endurance cycling event and, you know, making sure that I had that many carbs, or that I'm eating, you know, whole wheat bread because it's better than white bread, you know, those kinds of things. And not knowing that I was eating a plant that has been genetically modified over the course of the last 3 decades to be something completely different than what it was in the 70s.
And saturated with glyphosate on top, you know?
Right. So, you know, all of these things come to play. And like you ended up getting to a place where your body just said, And that was exactly what happened for me. And for me, it was 3 major stress events all within a short amount of time. So within 3 or 4 months, you know, I had a high altitude emergency in an aircraft that I had to deal with. I had crashed on my bicycle and left me with a dislocated shoulder and a C5 neck injury. And then I lost my mom. And all of those things coupled within those few months, sure enough, right after that was the diagnosis of Hashimoto's. And I kind of explain it to my clients that we always say it's the straw that breaks the camel's back, but what we forget is that there's already 10,000 straws sitting on the camel's back.
Exactly.
It's that last one that gets put on the camel's back that breaks everything down.
Yep.
And so, you know, really understanding that and knowing that can help us unravel all the different areas that we need to look at to start bringing back the body's homeostasis or balancing functionality so that it can function optimally in all of these different areas. But it is like peeling the layers of the onion in order to do that. It isn't a single root cause. So, yeah.
Which is why people say, I've been gluten-free, but I still don't feel well. I mean, that's just like one little piece of it. But
yeah, it is. Yeah.
You're absolutely right.
So, you know, I think the other part too that we could chat about real quick before we wrap up is just the experience that a client has or that you might have had just dealing with conventional medicine and not feeling heard, not feeling listened to, being told things that may or may not really be true. Did you have any of those experiences in your journey?
I did. One in particular stands out. I mean, my initial thyroid stuff was in my 20s, my late 20s. So I think that there really was not the connection now with like gluten-free. I think every doctor should know it, but I definitely have clients who go to their doctor and they say, I'm working on my diet, and their doctor says your diet has nothing to do with it, which is surprising to me at this point.
Very common. I think I hear that at least 3 or 4 times a week.
Yeah.
From people.
Yeah. For me, I went to the doctor. So my daughter, I was justifying how lousy I felt because of having a child who was so chronically ill and in the hospital. And I'm like, of course I'm fatigued. But it was to the point where I was literally like pulling myself up my front porch steps at 10 o'clock in the morning just to, you know, get myself inside so I could lay down. And I went to the doctor, and the doctor said, you should exercise. I was definitely overweight, right? I needed to lose probably 20, 25 pounds. And, because once I had my kids, like, you know, I just paid no attention to even losing weight, but who was going to lose weight? I had a thyroid issue and all this anyway, but she was like, you should. And I looked at her and I was like, I'm a personal trainer. Like, what I do for a living is exercise with people. And I wasn't exercising with my clients then. When I was younger, I used to do stuff with them, like run with my client, whatever. At this point, I was not doing that. But you don't need to tell me about like exercise. I had tried to exercise my way back to health. And I just looked at her. I'm like, I'm too tired. And she said, you just need to try. Like, just when you don't feel like getting off the couch, you just got to make yourself go get off the couch and do a walk, and you're going to feel better. And I was like, she has no idea the level of fatigue that I feel. There is no getting off the couch.
Yeah. 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 It's fascinating to me, the amount of just disconnection between the client that is clearly in pain, clearly, you know, fatigued, and really just hoping and wishing for answers. Yet their doctor, who is supposed to understand and supposed to listen, doesn't really listen or just completely misses the boat. You know, I had an experience with an MD who was supposed to be a functional medicine based MD. And, you know, he was one of the guys that I went to when I turned towards functional medicine originally. And, you know, I was in his office, and man, it's just so crystal clear. I'm in his exam room office, sitting on that damn table with the crinkly paper in the gown, the whole bit, you know, and I just asked him, I said, am I ever going to feel vibrant again? Am I ever going to feel like I have a decent amount of energy again? And he looked at me straight in the eye, straight faced, and he said, no, probably not.
Wow.
And
That makes me sad.
I think in that moment, that was a turning pivotal moment for me, because when somebody tells me no, I tend to be like, oh yeah, I'm going to show you, you know, and I knew, I walked out of his office. I knew that he wasn't the right practitioner for me. I knew that I was going to have to take matters into my own hands, and it made me become my own advocate. And that was probably one of the best turning points. I still cried all the way home. Don't get me wrong, but it was one of those turning points. And it just made me realize that there's so much of this disconnection between really caring for the client. And I think that's why we're starting to see such a surgence in health coaches and FDNs and functional medicine folks who really care, because almost all of them have had stories like myself and Linda's story, you know, and we've all had health crises of our own, and we can get it, and we understand, you know, and we're coming from a place of love. We're not coming from a place of, I've got another client in 15 minutes. Here's your prescription.
Right. I agree. Yeah.
So
I'm really honored to be a soldier in the war on chronic health conditions. That's how I look at it. Somebody posted on my page, and I know we probably went a little over, but I'll wrap this up for you. But she posted on my page, oh yeah, you're another one. All of you out there, how do I know any of you can actually help me feel better, or something like she posted. And my response was, I'm really honored there's so many of us out here, you know, like any other profession or anything, you're going to have good ones and bad ones, right? But I think that finally, this, like you said, the surge of this whole movement, kind of like a lot of things in the world, is saying like what was happening before wasn't working.
Doesn't work.
It doesn't work. And so now, I feel like a soldier in an army saying people need to feel vital again. People need to feel energy. Look around at America. How many people are unwell, overweight, sick, surviving their life? Like, that's not how we're meant to live.
No, not at all. And of course it breaks my heart, because those are the people that are being severely affected by the current pandemic. You know, it's really affecting those people with chronic health issues. And so it motivates me every single day to do whatever I can to help anybody turn their health around, so that they can be resilient against something like this, because it may not be our last pandemic. Let's hope it is for a long time, but it may not. So anyway, Linda, I really, really appreciate you coming on here and having this conversation with me. It was super fun. Time flew like that. And if anybody has any questions for myself or Linda, feel free to comment on these posts. I'll make sure to get the questions over to Linda and her answers back over to you. So yeah, we'll have to do it again.
I would love it. Thank you so much.
Okay.
Really great.
All right. See you.
Yep.